Hello everyone and welcome back. Today we're going to go over the research involving pregnant women and fetuses. Now let's go over some definitions first. DHHS, which is also known as the Department of Health and Human Services regulations, apply to research involving pregnant women and fetuses as subjects, and the purpose of which it is to meet the health needs of the mother and the fetus. Pregnancy is defined as it encompasses the period of time from implantation until delivery. Fetus is the product of conception from implantation during and until delivery. Dead fetus, a fetus that exhibits the following signs: no heartbeat, no spontaneous respiratory activity, no movement of voluntary muscles, and no pulsation of the umbilical cord. The federal research regulations require additional safeguards when approving research involving pregnant women and fetuses. These special protections are found in Subpart B. The IRB may approve research involving pregnant women or fetuses only if all conditions for research are met, that the research also meets the general criteria for approval. The description. The IRB must consider the general criteria for IRB approval for all studies, including those that involve pregnant women and fetuses. In determining whether the general criteria for approval are met, the IRB may have additional considerations for the research. These criteria would generally not be of concern in any normal adult population. The risks. Efforts should be made to minimize any potential harm. There may be also unforeseeable risks to the embryo or fetus for a particular treatment or a procedure. The possibility of unforeseeable risks must also be taken into consideration. The IRB may approve studies involving pregnant women or fetuses only if the research fits into the category 1 or 2 and also meets all of the following considerations in categories 1 through 6. In category 1, the research holds no prospect of direct benefit to the woman or the fetus. Any risk to the fetus is caused solely by the interventions or procedures that hold out to the prospect of benefit for the woman or the fetus. Category 2 is the research that holds no prospect of direct benefit to the woman or fetus, and the risk to the fetus is not greater than minimal, and also the purpose of the research is to develop important biomedical knowledge which cannot be obtained by any other means. Now, obtaining consent for research involving pregnant women or fetuses. Informed consent must be obtained from the necessary individuals as described below, unless the study meets the criteria to waive informed consent. For research that falls into Category 1 mentioned earlier, the board will make the determination based on the risk versus benefit ratio as to which consent process method is appropriate for the study. If the research holds the prospect of direct benefit to the pregnant woman and fetus, consent must be obtained from the pregnant woman. If the research holds the prospect of direct benefit to the pregnant woman only, consent must be obtained from the pregnant woman. Now, if the research holds the prospect of direct benefit to the fetus only, consent must be obtained from the pregnant woman and the father of the fetus. The father's consent does not need to be obtained if he is unable to consent because of unavailability, incompetence, temporary incapacity, or if the pregnancy resulted from rape or incest. For research that falls into Category 2 mentioned on Slide 8, consent is required only from the pregnant woman. Now, research on dead fetus and fetal material after the delivery. Research involving dead fetus or fetal material obtained after delivery must be conducted in accord with any applicable federal, state, or local laws and regulations. If information associated with a dead fetus or fetal material is recorded in such a way that living individuals can be identified through the research, then these living individuals are considered as research participants. The researchers must abide by all the regulations that apply to this group. That being said, you guys, there is a quiz at the end of this module. Please do take it before moving on to the next module. Thank you guys so much for tuning in. And once again, I will see you guys and tune in with you guys on the next module. If you guys have any questions or concerns, please email me at support@ccrpcourse.com. Thank you and have a great one. Bye.